Hello, my name is Robert Dillard. I'm 21 years old, and I've decided to start making a video series documenting my journey with diabetes type 1. This first video, I decided I just wanted to do a little bit of backstory about myself, how I found out that I have diabetes, um, basic information on what diabetes is for type 1 and type 2. And in the future, I'm wanting to make videos on advice on diets, how to properly inject yourself with insulin, how to properly test your blood glucose levels, among other things like exercising with diabetes, etc. So, first off, a little bit of backstory without boring you. I'm from Crosby, Texas. I was born in 2001. I'm currently 21 years old. My birthday is March 21st. I'm currently serving in the military, active duty Air Force. I've been in for almost 3 years now. As far as me finding out about diabetes and how I have it, I don't have much experience with diabetes as far as like before I found out about it. There was a couple people I knew personally that have it, but other than that, I didn't know much. And I'd never really been concerned about having diabetes. I think I had the bad information, like a lot of people probably do, that to have diabetes you have to be either obese, out of shape, eat a lot of sugar and candies. And I've always been skinny, and these last couple of years I've been working out a lot, watching my diet. I've gained some weight, packed on some muscle a little bit. And so I've just never been concerned about getting diabetes because I just didn't think that was something that could happen, and it was never something I looked out for. About 2.5 weeks ago now, maybe 2 weeks ago. Well, actually, let me backtrack a little bit longer than that. So, about a month and a half ago, so I'm currently stationed in Japan, and it's cold outside. And whenever it started getting colder, I noticed I started getting dry skin, dry lips, and dehydrated a lot. No matter how much water I was drinking, I was just very dehydrated. And I assume that because typically the cold weather has always, ever since I was a kid, the cold weather always gives me dry skin or like chaps your lips, gives you like dry knuckles. So I just thought me being dehydrated was a symptom of the cold weather outside and me not drinking enough water. So I was constantly drinking water, way above the recommended 64 ounces a day, and I was peeing a lot also. And I've never woken up to urinate in the middle of the night, but I noticed that I was waking up 2-3 times a night to go use the bathroom, and it was messing with my sleep, and I was just super dehydrated. Also, I started noticing that even though I count my calories and I work out a lot, I was losing weight. And typically I sit at about 145 pounds, which my goal is 155 to gain weight to, but that's a side note. Usually I sit at 145 though. Without trying, I'd sit comfortably right around that range. And I noticed I was dropping weight very rapidly within that 1 month. I got down to as low as 135, and so I just didn't know what was going on. So I felt very thirsty all the time. I was peeing a lot, and I was losing weight. And again, I just thought, okay, I'm not drinking enough water. I'm not eating enough. It's me. One day I'm at work, and I felt lightheaded and nauseous. And it was right after I didn't know what caused it at first. It turns out I was hyperglycemic at the moment. I was hyperosmolar, hyperglycemic state. I was in that state. And it's because that morning I hadn't eaten anything yet, but I'd had apple juice. And the apple juice had really shot my blood sugar up super high, to about somewhere in the 600s, 700s. We don't even know exactly what it was at because the glucose monitor does not read above 600, but it was definitely above 600. Anyways, I noticed I was lightheaded. So I let my supervisor know. I went to the emergency room, and I got there. I thought it was like a fever or something. Again, I had no idea what it was. Essentially, they were confused too at first. It took about an hour to really realize what was going on. They were asking me questions. I told them well, lately I have been a little bit dehydrated. I've been peeing a lot. And they kind of, looked at me weird. They were like, oh, let's test something. So they tested my blood sugar, my blood glucose levels. And it turned out, yep, it was above 600. They put me on IVs to hydrate my body because I was severely dehydrated. They started doing tests on me. And then they started to do tests on me. I was having to drink a lot of water while I was at the hospital. And I was also having to contain all of my pee. And they wanted to see how much I was absorbing of the water that I drank. And it turned out I was type 1 diabetic. The reason I was so dehydrated, I was losing weight. From my understanding of what I've read and also what the doctors have told me, is that when you are diabetic and your blood sugar levels are super high or super low, I believe as well. I'm not entirely sure on that. But for sure super high, your body cannot absorb the nutrients like it should. So water you're drinking, food that you're eating, it's not properly being absorbed. So it's just all flushing out instead of being absorbed. That's why I was losing weight. That's why I was severely dehydrated. Most people that are diabetic like that and they're not absorbing those nutrients, they can go into a comatose state, get very shaky, lightheaded. And luckily that didn't happen. I had gone in just at the right time. Now I have some notes. I've been going to the library and getting a lot of books, a lot of literature on diabetes and the glycemic index and nutrition, like diet plans for diabetics and stuff. So I've been taking a lot of notes. Right now I just want to kind of dive into what type 1 diabetes is, what glucose is, what type 2 diabetes is. I don't have that, but just so we can have an understanding of everything. I'm not going to read this verbatim, just, I'm going to try and say this in my own words. So glucose comes from two major sources, the foods you eat, and then it also comes from your liver. The hormone insulin comes from the pancreas. Insulin lowers glucose in your bloodstream, and as your blood glucose levels drop, so does the secretion of insulin from your pancreas. So pretty much your pancreas is what produces insulin. You have beta cells in your pancreas that produce insulin. And, type 1 diabetes, which is what I have, it's an autoimmune disorder. So your immune system is typically supposed to fight off infections, disease, keep you safe. For some reason, and this is the strange thing with type 1 diabetes, doctors don't know what caused type 1 diabetes. There's theories, there's guesses, but no one really knows for sure, because what it is your autoimmune system starts attacking the beta cells in your pancreas. And whenever that happens, your pancreas can no longer produce and secrete insulin into your bloodstream, because all that glucose that is made from eating food, it goes into your bloodstream. And while it's in your bloodstream, it's supposed to be absorbed. And without the insulin, it can't be absorbed. So now you have all this blood sugar in your blood. And that's why your blood sugar gets so high, is because it can't get out of your system. There's no insulin. So, and then that is what type 1 diabetes is as well. It occurs if your body makes little to no insulin. Type 1 is an autoimmune disease. Your body's autoimmune system attacks the beta cells in your pancreas, stops the production of insulin, and 5 to 10% of people with diabetes have type 1. So that's, again, it's just pretty much you're very unlucky if you have type 1 diabetes. People don't know if it comes from family members or, diet choices. But again, I don't think it's my diet. I have a very healthy diet, I like to think. I work out a lot. I'm very active. So, who knows? And no one in my immediate family has diabetes that I'm related to. So it's just a very strange case of, it is what it is. Type 2 diabetes. Type 2 diabetes occurs when your pancreas still produces insulin, but your cells become resistant to insulin. So insulin can't help move glucose into your cells As a result, most of the glucose stays in your bloodstream and accumulates. Most people with type 2 are overweight. So, as I just read, type 2 diabetes, your body is resistant to the insulin. So you have insulin in your body, but your body's just resistant to it. I believe it's resistant because like fatty tissue, sugars in your body, and you're overweight, so your body just can't absorb it. I did read that there's cases of people that are overweight, they get type 2 diabetes, and as they work out, as they lose weight, their body becomes less resistant to the insulin and it can start absorbing it. And there's some people that have reversed having type 2 diabetes just from working out, eating healthy. So it's very interesting. And type 1 diabetes, 5 to 10% of people have it. Type 2, about 90% or so of people have type 2 that are diabetic. So it's very interesting. Gestational diabetes, or gestational, I'm not exactly sure how to pronounce it. I'll just say gestational for now. Gestational diabetes occurs with women during pregnancy. Hormones secreted during pregnancy increase the body's resistance to insulin. It typically occurs in the second half of pregnancy and typically goes away after childbirth. About half of women that experience gestational diabetes will have type 2 in the future. So, a woman gets pregnant, second half of her pregnancy, she becomes diabetic. So, and like it said, it is a foreshadowing that the woman will possibly have type 2 diabetes in the near future, possible future. So, probably a good idea that after childbirth, after they heal up and everything's good to go, that they probably start watching their diet, probably start working out a little bit, go on walks or light jogs, something like that, to try and, keep that from happening. Okay, so let's see. I'm probably just going to stop it here. I think I'm going to make a video in the near future on the long-term complications and medical emergencies that could happen from diabetes, signs and symptoms, what you can do to try and prevent those from happening. Like I said, I'm going to do videos in the future on how to properly inject yourself with insulin, how to properly test your blood glucose levels. I'm going to talk about how to exercise with diabetes, what you should probably try and do as far as diet-wise. And again, I'm not a medical expert. I'm not someone has a lot of experience in this field or topic. I'm just someone that has recently been diagnosed, and I've been doing a lot of reading at the library and taking a lot of notes and looking online. So I'm not an expert. So anyone watching this video, if you know more about any of these topics, or if you want to share some things, if you want to leave a comment, and that way I know and anyone that watches the video knows, that would be very helpful and I would appreciate it. Thank you for watching, and yep, I'll see you later. Thank you.